On Monday, Oneida County Executive Anthony Pacenti announced another fatality from coronavirus. The total number of deaths is 15. There were 5 new positive cases, creating 378 in total. Of those positive cases, 215 are active, 29 patients are hospitalized, 148 cases are resolved. On Monday, the Herkimer County government Facebook page announced 4 new positive cases, bringing the county's total now to 78. 2 patients are hospitalized, 3 have passed away, and 45 cases are resolved. In Sunday's update from the Otsego County Department of Health, it confirmed 1 new positive case of coronavirus, their county's total now reaching 58. Of those positive cases, 3 patients are hospitalized, 4 have passed away, and 45 patients have recovered and are no longer in isolation. As of Sunday, approximately 291,996 New Yorkers have tested positive for coronavirus. In Monday's daily briefing, Governor Cuomo announced 337 deaths from coronavirus overnight. He says that the curve is continuing to flatten and the new number of positive cases is slowly declining. Cuomo also readdressed the state reopening. Similar to how each state is creating their own methods for combating coronavirus, he says each designated region in New York will also do the same. Each region must follow the CDC's guidelines and have a 14-day decline in the number of positive cases, hospitalizations, and deaths. Reopening will happen in phases. Phase 1 will allow certain construction and manufacturing industries to reopen, but the governor says we still need to determine which ones. He did not clearly identify phase 2, but we do know that there are a lot of uncertainties that must be addressed before fully reopening. For example, businesses that wish to reopen must have precautions in place such as social distancing and monitoring how the operation is impacted upon reopening. Regions that reopen must also consider the hospital's bed capacity. So, is their hospital able to handle a large influx of coronavirus patients if there is a second wave, or once flu season hits, having coronavirus patients and patients that are impacted by the flu? Do they have the capacity to handle that amount of people? That's something that all regions need to consider when they are reopening. Cuomo says that regions must also have sufficient access to testing and tracing systems. Regions should also consider creating isolation facilities so that patients infected with the virus can stay in a designated building until they are well, and this would help avoid transmitting the virus throughout a person's household. Cuomo even suggested businesses take a temperature of employees before even entering the building to ensure that they are, in fact, well. Regions must also have plans in place for operating schools, keeping transportation safe and sterile, testing and tracing. He talks about that a lot. Cuomo says to avoid reopening attractions such as beaches, amusement parks, or other places that promote large gatherings of people. This could cause residents from outside of the area to come in and flood that region that has reopened. So as people do consider to open different businesses in their regions, they have to consider that it might cause other people to come in and take advantage of places that have reopened. On Saturday, the state expanded the diagnostic testing criteria. So this week, drive-through testing facilities will open in Broome, Erie, Monroe, Niagara, and Oneida counties. So you can't just show up. You have to call the COVID hotline number at 1-888-364-3065, or you can go online to covid19screening.health.ny.gov. The next daily briefing will be Tuesday, April 28th, right here on our website, cnyhomepage.com.